Hello, welcome everyone. In this webinar, I'll give you a view on the current open call that we have for small and mid-sized enterprises within the EHDEN project, the European Health Data and Evidence Network, an IMI initiative. I'll discuss three main topics. First of all, I'll give you a bit of background on the EHDEN project, what it is and what we're trying to do. Secondly, specifically related to the value that it brings as a small and mid-sized enterprise and what role you can play. And thirdly, we'll go into somewhat more details of the actual call, the call specifics for the small and mid-sized enterprises. Let's get started with what's at the core of the EHDEN project. And that is what we could call in one sentence, the journey to real-world evidence. Real-world evidence being the data that is being used in routine clinical care settings to generate evidence, to generate additional clinical insights. And so in general, it starts from a data set or multiple data sets, which is represented there at the left-hand side, patient-level data in the source system. And it follows a long and windy and often very complex road to result into what we call reliable and repeatable evidence. That's exactly the journey that EHDEN is trying to tackle, with actually focusing on a reproducible data flow, so that it's clear from where the data is coming and how they actually result in evidence at the end of the day. And secondly, by relying on a common data model and standardized vocabulary, so that at the source, the data that is being used to generate that evidence is indeed consistent and reliable. So that's really the purpose of this blue box, the patient-level data in what we call the common data model structure. And so with an analogy, we can actually represent this as also here with the iron. At the end of the day, our method, we want to have a consistent method. We want to basically apply our iron. Now, depending on the country where we are, we might need a different plug. And so what our objective is to find that common plug, that common data model, which will allow us to use our consistent methodology. And therefore, we need to focus on a couple of aspects. First of all, achieve that data interoperability by establishing a common data network. Standardized analytics, which are only being made possible by standardizing on such a common data model. And of course, we need to have the technical infrastructure, the data network itself, to apply that across the network. And we also need to be backed up by a strong social component, a strong community to drive these standards, these methods forward. The EHDEN consortium itself is a project under IMI started in November 2018 and running till the end of April 2024. It consists of 22 different partners, consisting out of a public organization, different universities, with Erasmus Medical Center as the academic coordinator, with different small and mid-sized enterprises, and with also large pharmaceutical FPA partners and associated partners as well. In total, the budget is about 29 million. And what it is that we're trying to do is pretty straightforward. It is to develop a federated network of healthcare data sets, which are standardized to a common data model, and that we can apply consistent research methodologies on to generate real-world evidence. It's envisioned to be the trusted observational research ecosystem, with at the end of the day to drive better health decisions, outcomes, and care. There are three foundational pillars. One is the infrastructure, the pure technical component, which is very much at the focus of what we're discussing today. So the creation of that EU federated network architecture with privacy by design, and I'll zoom in on that in a second, and the data harmonization to that OMOP common data model. To achieve that, we're embarking upon an initiative to train and certify SMEs who will help us in this journey. The second pillar is the research and outcomes. So we have identified different use cases to evaluate actually our technical and social construct, the EHDEN federated framework, with also a specific focus on developing further the consistent methodologies in function of the different use cases that we will explore on this federated data network. As part of the outcomes, we're also looking to incorporate the ICHOM health outcome standards in this common data model and perform also studies on that. The third pillar is the educational and community component, with the establishment of an EHDEN Academy, and how that fits in you will see later in this presentation, and the expansion of what we call the OHDSI network in Europe, because EHDEN itself is relying on what is already mentioned, the OMOP common data model, and the OMOP common data model is largely built by a global community called the OHDSI community. So we have a strong collaboration and interaction with that OHDSI community across the globe, and then specifically also in Europe. What are the benefits of such a federated data network? Well, core to it is that the data, the patient level data, always stays under the control of the respective data owner. So it stays local. That means in terms of governance, that governance can be controlled locally. Under GDPR terms, it's privacy by design, because there is actually no patient level data that leaves the owner's side. It's only the results of an analysis. And to paraphrase it, we sometimes refer to it that we bring the analysis to the data instead of bringing the data to the analysis, which is the typical setup when you are working with centralized data repositories. Of course, we rely heavily on the use of and establishment of such a common data model. Let's not forget the social construct, which is the close collaboration with the different data owners to have that so much needed trust. The next slide is a graphical representation of how it works. So centrally, we do have the EHDEN platform, which does never contain patient level data, but it allows you to one, explore the metadata on the different data sets, but it also can be used to formulate a study. And the study is the script, or the analysis is then being sent to the different databases via a system called Arachne. And in the different centers, the different data sets, which you see on the left-hand side, there are 3 of them here, they have converted their data into what we call that OMOP common data model. So with one script, all these different databases can be interrogated because they exactly speak the same language. And it's only the results of those queries, of those analyses, which are being fed then back to that EHDEN platform. Now, as I mentioned, core to it all is that OMOP common data model. And here you see a graphical representation of this OMOP common data model with the different tables in it. So the most important tables from a transactional perspective are the ones at the left-hand side in blue. These are really the event tables in conjunction with the patient centricity of the OMOP common data model. All the transactional tables, whether it's visits, procedure, drug exposure, device exposure, conditions, measurements, observations, they are all always referring to a patient, to a person, and are always longitudinal. So they always have dates associated with it, with at the end of the day to be able to always reconstruct an entire longitudinal perspective on the patient and the trajectory from a healthcare perspective that these patients went through. In addition, you have the middle section where we have what we call the standardized health system data. So they relate more to the care site, the provider, and possibly geographical indications. In the middle part, we have health economics related factors. And at the bottom part in the middle section, we do have analytical components which are being used to identify, for instance, particular cohorts of patients in your population. And on the right-hand side, we have the data that comes as a given with the common data model. So this is, for instance, all the master data. Core to it is that everything that is referenced in the transactional table is using existing terminology systems, and they are represented as concepts, which can vary from SNOMED, LOINC, RxNorm, and a lot of other terminology systems. But all of these terms, all of these concepts are contained within the OMOP common data model and are referenced in the transactional tables. Now, specifically speaking on what the role is for those small and mid-sized enterprises, what are we looking to offer, and what is possible? Well, first of all, it's a tremendous opportunity as a small and mid-sized enterprise to develop your skills in the growing market of these real-world evidence, real-world data. We offer you a free training and certification curriculum. You can look on ways to expand your commercial offerings. Maybe you're currently focused on imaging data analytics or healthcare interoperability. Well, with actually putting this to your stack of skills, you might look at broadening your commercial offerings. Let's also not forget that at the end of the day, we're mapping healthcare data with the objective of ultimately indeed improving the healthcare of our fellow citizens across Europe. So we're also actually providing greater social good. You can rely on an already impressive set of open source tools, including training and documentation. And you actually also have the opportunity to be at the forefront of healthcare data analytics. Now, how does the call process itself work? So as part of the EHDEN project, we have what we call a harmonization fund. And that is intended at the end of the day to convert as many data sources as possible to these common data models in order to basically be able to use the map data in clinical research initiatives. And so in terms of the call, we're focusing on two streams. One is, of course, engaging data partners. So organizations who have healthcare data and who want to have them mapped into that common data model. And secondly, the bottom one, and the one that is currently in focus, is in terms of the small and mid-sized enterprises, where we really look to engage you to support the mapping of the different data partners, data sets to these common data models. And so you can apply through this open call to participate in this, to be trained and to be certified in performing this operation. And at the end of the day, so while the data partners are going through their open calls and the SMEs are going to their open calls, there is a kind of matchmaking where then data partners from the can basically interact with the certified SMEs and select those SMEs for engaging them directly then to map their data source, or at least contribute in the journey for the data partners towards the map data. In terms of where we are currently with the existing data partners, so this is after 3 open calls. So we currently have 61 data partners, where you see the geographical spread across Europe in this slide. And similarly for the SMEs, so currently 26 are certified, and you also see the geographical distribution on this map. Now, in terms of those open calls, I already mentioned there are 2 different ones. So the first one, and the one that we're talking about here, is the SME call, going from March 15th till April 12th. And we do also have 2 distinct data partners calls, one from April 15th till May 13th, and then another one in Q3 from September 15th to October 13th. Now, specifically more zooming in on the SME call. So the submission period or the application period is March 15 till April 12th. And then we actually review the submissions with an expert committee between April and mid-May. And the prioritized SMEs will subsequently be invited for training, which will cover in the period mid-May till probably end of July. And then the period August-September will reserve that for a set of certification meetings. So who can apply for this SME call? Under the EU definition, the headcount should be below 250 staff members, and the turnover should be less or equal to 50 million euros or a balance sheet of less or equal to 43 million. And important, you need to be a legal entity and based in an EU member or in Horizon 2020 associated country. So every application that gets submitted gets individually reviewed by at least 2 committee members. And what we're looking for is, first of all, whether you have a certain affinity towards the healthcare field, to the domain, but also in terms of the technical capabilities, whether that's within your area of expertise. We're also looking to see whether you have the capacity to actively engage with the EHDEN community at large. And important also is that we assess your capability to add value to the EHDEN network. And this can cover different aspects. It can be related to expanding the code base, the tooling that is available, for instance, for the data mapping, whether you've already have proven experience or contribution in open source initiatives, whether you have a network and relationships with one or more healthcare organizations, and that can be basically everything from hospitals, registries, payers, population databases, and whether you are or do have the potential to train the community. To support you, we'll have one very important instrument, which is our EHDEN Academy. It's an e-learning environment to train all stakeholders, and in particular, of course, the SMEs. So there are different courses already available. And in the call for the SMEs, we focus on a couple of aspects. One is, of course, the foundational aspects of EHDEN. The OMOP common data model, and understanding that at depth is, as you can understand, at the core of the skills that we're looking to establish. So there is quite a bit of focus on that. There is the infrastructural element. How do you install the different tools? Also from a training perspective. So that's covered in the infrastructure and the OHDSI in a box training curriculum. And of course, the technical aspects and the best practices related to performing that transformation from a source data model into the common data model, which is covered in the ETL training documents. Overall, in terms of the EHDEN Academy, we're looking to further expand the capabilities also of the courses offered. So we're looking to expand into the clinical characterization, how that is being done, the data quality assessment and reporting, which will be a pivotal component also for the SMEs participating. And then you see further on several other trainings which will be provided by the end of this year. So, and with that, as a service, as an SME, as a certified SME, you will be taken up in the service provider service provider catalog that is part of the EHDEN portal. Additional tools that are available and that we strongly suggest to participate in is, like we mentioned earlier, the OHDSI community, where we do have the forums from OHDSI, which are a tremendous source of knowledge and information. There Also, a lot of the learnings have been combined together in what we call the Book of OHDSI, which you can download for free or order via Amazon. And let me conclude by giving you the references where you can find more information on this call and on the EHDEN project. Thank you for your attention and wish you good luck as a candidate SME. Thank you.